So summer's coming to a close and school's getting ready to start. This is such an exciting time for your children and you as you're trying to help them get ready, including getting their clothes. They like to look nice, but what if they've got warts? Warts can happen anywhere, but if they're exposed, that can be so embarrassing. It's fairly common. 12% of the population's got warts, but what can you do about that? How can we help your children? We're going to share that information with you in just a moment. Today, we've got Jake with us, one of our compounding pharmacists. So Jake, what are warts? What are we dealing with?
Well, warts can vary by different classifications, depending on location, description, even the cause of it, varying anywhere from the common wart, where you'll see pop up kind of everywhere, or the plantar wart that you'll see on the foot. They're typically bigger on those load-bearing spots on the heel. But warts are basically a viral infection is what they are, caused by HPV. Typically transmitted through an open wound, can be from person to person.
Okay.
If there's an open wound and the immune system is not strong enough to fight it, or it could even be from an inanimate object. Same thing, open wound, immune system's not strong enough to combat that.
So what can we do to treat these warts?
Right, so there's several over-the-counter products you've probably seen. If you just go to any typical pharmacy, they're going to have some products like something for salicylic acid that's basically going to help to kind of soften that wart and separate it and eventually get that wart off. There's CRYOTHERAPY, which is basically freezing the wart off. Can be pretty painful, can cause some harm.
So we have the traditional type things, but what do we do that's different? What does Flourish do?
Right, well, the problem with some of the standard treatment is it can take a long time. And like I said, with the freezing, can be painful and very irritating, especially for a child. And so there's a couple of things we compound here pretty regularly. One of them is CANTHARIDIN. It's a blistering agent, actually. So you apply it to the wart, and it forms a blister underneath the wart, and it will typically fall off. Some doctors like to have it actually removed from the blistering agent, but can even fall off on its own from that blister. The other that we see pretty standard is DCP or DPC. It's diphenylcyclopropanone. Big word, just a sensitizing agent or for immunotherapy. So you actually apply it to the wart, recruits the immune system to fight that wart from the inside out. And this is a good option for a quicker, typically pretty pain-free option to fight that wart for a child.
Okay. So how can somebody get one of these special compounded products?
Right, these are prescription only, and so the best way would be to go to your doctor, talk to them, let them know about a wart going on, and see if this could be a good option for you, and have them give us a call. If you don't have a doctor you can go to for that, you can give us a call, and we'd love to talk through some options of some doctors we could refer you to, or a way to get you a prescription so that you can get that wart taken care of.
Okay, great. Okay, Jake, thanks. So if you'll go to our website, flourishrx.com, click on the blog button, we'll have more information about prescription products and things you can do to help treat warts.